This is one of Dr. Buford's before and after pictures.
So this is a 35-year-old patient that came into me, and this is going to illustrate, you guys have all these elaborate, complicated ways that you're treating these things. I didn't do an awful lot to her, but I do think it created a nice rejuvenated appearance. So what we did, we basically started with the fabric. Okay, put her on a medical skincare regimen, a series of chemical peels. We use a lot of microneedling, PRP in our practice as well too, a lot of biologics. That's why you're seeing the improvement in the skin. For the upper third, what you're seeing is the effects of the neuromodulator, as you pointed out with the brow. Tried to shape that. Mid face, I try to recreate a V-shaped look, and so I use a lot of fillers for the chin point, lips, also cheeks, so you can create that V up on a woman. I think it's beautiful. So what I did is Voluma in the cheeks, Volbella in the lips, and I actually didn't do anything in the chin here. For the neck and jawline, I use the effects of Kybella, which Kybella not only dissolves fat, but it also creates inflammation. And so as we know from inflammation, what happens with that, we get skin tightening. So, what I was trying to do essentially is not only get rid of a little bit of fat, so fat dissolution, but also too, I come up along the jawline, I inject the jowls, and I try to create basically a little bit of a lip. So that's what I did for her. Very happy patient, and again, I think, I think it really kind of illustrates how you don't have to get very complicated. And you certainly don't have to, as we've got surgeons sitting out there, you don't always have to go the surgical route and you can get a result for a patient that are very pleased with. And that's durable as well.
How many sessions of Kybella did you do to get this result?
I did two vials apiece.
Okay.
And when you do the Kybella, are you using it as a mesotherapy technique into the face as far as for skin tightening? You're diluting it down, or using it full concentration?
No, I'm just using it.
Full concentration, but just lower dosing as far as the injection sites?
Right. Yeah. Usually I'm using about a 0.1. I mean, a lot of times if you're using it for fat dissolution, you're using about a 0.2. So I go a little bit less, and I really spread it diffusely, so I'm creating more of I'm kind of really shrink wrapping everything. So I'm trying to address the submental fat, but also trying to address the skin laxity around that, creating more strength in jawline.